HPV. Learn more right after this.
Hi, may I please have an application? Thank you.
Skip the drama. Get your diploma.
Okay.
Take that first step towards a better future. Find free adult education classes at finishyourdiploma.org.
Welcome to Community Watch. Greg, how you doing?
I'm doing fine, you sir.
Okay. Well, it's probably good we start out with a light moment because this is a pretty serious subject we're talking about.
It is. It is.
In fact, it's not unusual for me to not know about a subject. That's pretty common.
I'm same boat.
Well, yeah. But in this case, I would say that this is a subject that I probably heard of the first time just a few years ago, not very long ago at all. And I still don't know a great deal about it, so I'm hoping to learn about HPV.
Well, I agree. It's one of those things that I've heard about, but from a male perspective or men having responsibility dealing with HPV, I've never really heard that aspect of it till recent, till a couple of years ago. So this was a show that Angie Robson called us, and it was one of those things where we knew we had to do it, because it fit right in line with what we do. But it's one of those shows I plan to learn a lot as well, because it is just so much stuff that we don't realize we don't know.
Yeah. Well, it's an important show that we'll be having today, an important one for you to see. We want you to stay with us. We'll be joined by our two guests right after this, so please don't go away.
I'm transferring to the University of West Georgia.
Columbia University.
Kennesaw State.
UGA. Loyola University in Chicago.
Grambling State.
Shorter University. I'm going to Greensboro College, and we all got our start at Georgia Highlands.
No matter where your educational journey takes you, you can get your start at Georgia Highlands College. Georgia Highlands College. Enroll, engage, excel.
Welcome back to Community Watch. We're very happy to have with us today Angie Robinson and Dr. McCoy. Welcome.
Welcome. Thank you.
Glad to be here.
It's a pleasure.
Well, I'm going to start just by asking some very basic questions. And let's start with what is HPV?
I'm gonna.
No problem.
I'll give you the long word because
Okay.
that everyone says HPV, but it's human papilloma virus, which is actually a very common virus, and there actually is over 100 strains of the virus. Our concern today is 4 of the strains, and that's what we're really going to be talking about. 2 of the strains cause cervical cancer and also some male cancers that we're now learning, and there's 2 strains that cause genital warts.
So we're talking about an STD.
It is sexually transmitted virus, yes.
It's the most prevalent STD.
The most common
Prevalent,
one.
Yeah.
So
Wait a minute. I got to go back to that one.
okay.
Hold your
All
question.
right.
Because you never hear that.
Right, a
When
lot
you
of
think of
people-
STDs, you don't think of HPV. You know about the big ones, the gonorrhea, chlamydia, HIV, stuff of that nature, but I don't think I've ever heard that HPV is the most prevalent STD.
I should say the most common one around here because a lot of people who have it and don't even know it.
Don't even know it.
Yeah, so when the guys are, when the transmission is going back and forth, no one knows until something presents, and unfortunately, it's usually the female who presents. However, we're seeing more in the males now, but it's not in the usual sexual fashion. Times have changed. So.
Now, has this always been around, and it's just not one of the ones that I remember hearing about growing up?
I think it's been around. They just didn't really identify it.
Right. With all the DNA technology and probing that we're able to do now, we've been able to identify not just the virus itself, but the many different strains and the ones that are more pathogenic. You know, she mentioned 4 of them. There are 4 main ones. I think it's 6, 11, 16, and 18. Yeah, the first 2 cause the lesions in the genital areas, and the latter 2 are the ones that lead to cervical cancer, which is a big reason why we're having this discussion. So,
now let me go back, because I'm thinking about teens, and when you talk about HIV, we're always talking about sex and sexual practices. But this is one, if people have it and don't realize they have it, I guess just like HIV, and you're waiting for it to present. So really, when you have more than one partner, you really don't know where you got that from, because you could have been infected but nothing ever presented. And I'm guessing the window for something to actually present could be a while.
right.
Yeah.
Or the first episode could just be a little small lesion that may go away and then pop up as a big, broad spectrum of lesions later. And by then, they've already infected maybe several people. So. It's been around for a while because, well, I've been practicing medicine for over 20 years now. And when I was a medical student, I interned with the urology department at Albert Einstein Medical Center in Philadelphia, which was a tertiary care facility for burning the HPV viruses, also known as cauliflower lesions, off of the male genitalia. I mean, they would spend a whole day just doing just that. Very contagious. We had to wear a mask and have the room aerosolized so that we wouldn't inhale the viruses, because there was some thought that if you inhaled the viruses, you would end up having the viruses grow inside your respiratory system. So it's been around for a long time. So people don't talk about it. I mean,
why not?
That's what I was about to say. Is it because I don't know, because I know we can be male chauvinistic. But for the longest, HPV cervical cancer has been perceived as a woman's disease, a woman's problem. And I'm wondering, is that part of it, because it doesn't affect males, or we, I guess, have no symptoms for the most part, that we've kind of just, it's not important really. I'm not saying that's it, but I can't help but wonder if that's not part of it, because we don't necessarily suffer from,
well we do, but the women present with cervical cancer. Yeah. And the route that they normally acquired is the normal sexual route. So you're more likely to hear about that. Well, in men, it's more of the increased gay community, having it in the anal areas, but also with just atypical sexual behavior in some people's minds, even between the heterosexual couple. A male getting it in the anal area from, contact from the mouth to the vagina and back. So it's all different ways of contracting it. So.
And once they realized that it was safe to give the vaccine for boys, which about 3 years ago, not quite that long ago, that's when we really started the push for boys to be vaccinated, because the more boys that are vaccinated, again, we're still preventing cervical cancer because they are not spreading the virus to women.
Right.
So really we're talking about a workaround to preventing cervical cancer is to really have less men affected with the virus from the beginning.
Yes.
So we're talking about education and awareness and making men aware that we are part of this problem.
Yes, and that men also need to be vaccinated.
Right. Although the vaccination is not a panacea, it doesn't give a license to go out unprotected. Condoms are still recommended. So that it's not an excuse to not wear a condom. You still got so many other things out there. So.
And I think one of the exciting things, it is a sexually transmitted disease, but don't forget, this is our first vaccine against cancer. We've been waiting for this forever to develop a vaccine that will actually prevent cancer. This is the first one.
Wow. That's actually a good point.
Yeah, and that's kind of our focus And I think because it had been controversial when it first came out, and now there's really this big trying to really make the public aware this is really a cancer vaccine.
Right.
And I mean, it's so important that all of our young people, I mean, why would you not want your child to be protected against cancer?
Yeah.
Well, let's just be honest, because sometimes we want to struggle. We don't want to accept the fact that our children are children, and children do make decisions that we don't necessarily, agree with, but they do make decisions. But I'm kind of curious, because when you think about it, and you talk about the prevalence of a doc and how many, so I'm assuming that the majority of people who probably have HPV don't even know that they have HPV.
That's true.
And so
you could
can't
be dating a young lady for 5 years, and then 6 years later, let's say you break up 5.5 years later, and 6 years later she pops up with the lesions. Did she get it from the new boyfriend, or did she get it from you? Kind of like herpes.
Yeah.
In fact, they're kind of similar viruses, except this one is far more virulent. So.
Another point to make is women, we can detect it through their pap smear.
Right.
The pap smear detects cervical cancer, and because HPV causes cervical cancer, it will come up in a pap smear.
Right.
We have no way to test boys at all. Yeah. That is also why the vaccine is so important. Prevention is key, because we have no test yet.
Unless they present very late with these nasty cauliflower lesions, which are very obvious by the time you get them to the operating room. But then it's kind of late. So.
Well, let me ask. The vaccine is a prevention. Is there anything you can do for people who have HPV already?
Some of them, it's still recommended that they get the vaccine as long as they're within the window of treatment, which is between 9 and 25 years of age on one vaccine and 26 years of age on the other. But the more common one that covers all 4 of the pathogenic strains would be up to age 25. So it was initially for girls, and it was a hard sell early on because women are like, why? It's a big problem with vaccines already in this country, as you know, and with DPT and all these other issues with mercury and so forth. So now you're talking about giving a 9-year-old girl who's not even sexually active, whose parents are hoping that she won't be sexually active until she's 25 and 30 and married. You're talking about giving her 3 shots of this vaccine in any event that she becomes sexually active. So it was a hard sell. And so now it's becoming an even harder sell with the boys. But
so
it is
I was going to ask, so
necessary.
what age can you start vaccinating young boys?
Age 9.
So boys can start taking this at age 9?
Same age as the girls, yeah.
And you're right, because I have an 8-year-old, and I'm thinking next year he'll be 9. He's still playing, that's not even part of his reality.
No, but it's just a vaccine.
Vaccine.
It's like, getting his polio vaccine.
Right.
It's just another vaccine at this point.
And that's what, and I'm thinking, as you said, I guess that's how you have to approach it, because as a father, you think he's just 9. He's not, but you don't think about polio or anything else when you vaccinate your child. You just, we do this.
Although I think this one is even more of a reason to get it, because if his daddy is a sexually active being, and I assume you are because you have a son, then he's likely going to be a sexually active being, and he's going to want to participate in that normal behavior, and so he's even more likely to get that than chickenpox.
So really, I guess the dialogue has to be in the public, for public awareness, is this a vaccine that most adults, most people at some point going to participate in some aspect activity that you could actually be vulnerable.
And it doesn't have to be through the usual intercourse. I mean, it could just be, fellatio or, that type of rubbing and kissing kind of thing also.
Yeah, and that's a good point, because HPV is actually what's considered a skin-to-skin transmission. It does not require body fluids.
I mean, we wash our hands a lot.
So we got pamphlets on this, because I'm thinking, I got to protect my children. But wow, because I'm really taken aback, because we don't talk about HPV as much as we talk about some of these other viruses.
Unless you're at the health department, right?
Right, we do talk about it a lot there. So this is a good public awareness.
I still can't get over how little I hear about it. Even if I don't know much about it myself, which is not a big shock, but just the fact that I haven't heard much about it. It's been around as long as it has been.
Yeah, well, guys certainly don't talk about it. You know, they'll come into the office, you know, quietly with their head down when they get to the reception area and, you know, say, I just want to talk to the doctor. When you get in the back, you realize that, and some of them have had an explosive outbreak that they've never discussed with anybody for years.
Wow.
And, you know, they didn't show their moms because they're, you know, beyond the age of mom seeing what's in their underwear, so.
Well, we're coming up on a break. We have lots more to discuss about this. Please stay with us.
Looks like it's done.
Don't let salmonella get funky with your chicken. On average, 1 in 6 Americans will get a foodborne illness this year. You can't see these microbes, but they might be there. So learn the right temperature to cook each type of meat. Keep your family safe at foodsafety.gov.
Welcome back to Community Watch. We're talking with Angie Robinson and Dr. McCoy about HPV, which is an STD that we don't hear as much about as we should, and that there's a vaccine that a lot of talk has been out there as a vaccine for women, but we're talking about the need for men as well. All right, I've got to ask about the vaccine a little more because my understanding of vaccines is that they are preventative, but you're saying that they can also be effective with individuals who already have the virus.
Right, just in a way that a varicella or chickenpox vaccine could be effective in someone who's had a small minor outbreak of chickenpox. They didn't have a big enough antibody development to protect them, so they're still okay to get the vaccine. I was actually one of those people, so, you know, so, yeah.
And the vaccines are for beginning at age 9 for both boys and girls, yes, up to 25 or 6? 25?
25, yeah. 25, the main one that we use. I guess you all are using the one, right? Yeah.
So for those of us that are over age 25, it's just too bad.
If you come in at 25, if you come in at 25 and a half, I'd probably still give you the shot. Or if I know you're a high risk individual, we're still gonna give you the shot. So.
But having 3 boys, 1, 8, 23, and 22. I mean, I'm really like, I got to have this
Take
conversation.
them all at the same time.
Yeah, because this really changes. This changes things. I mean, as a father, I'm thinking, wow, you know, are they aware of HPV and how prevalent it is and things of that nature. So, well, this is part of the whole reason why we're having the show in the first place. Yes. But the vaccine itself, now I think you said 3 shots. Is that for
series of 3 shots?
So it's the same. So the vaccine is the same regardless of gender.
It is.
So it's a series of just 3 shots. Now, is that over time? Is that?
It's over time. You probably know the schedule better than I.
So usually a month or 2 between them.
I think over 3 months. Yeah, I think the last one's at 6 months. Is it 1 month, 3 months, and 6 months?
Yeah.
Kind of like the hepatitis vaccine. Yeah, I'm not specific on that.
But I'm thinking with B2B, you know, that's 120 guys, you know, in that program. You know, this is a conversation.
You know, I'm curious if I just said, you know, how many of you know what HPV is? I wonder how many of them would know.
How many of them would know really? You know, yeah, I know, but do they really know in the way it's transmitted? Because that changes things when you say it's not just a sexual transmission, but it's considered skin to skin. So
it's skin to skin, but in a sexual type contact.
Yeah.
Right. Yeah, and just to reiterate your point, you said it's the only vaccine for any cancer. It's actually the only vaccine for any established, well-known STD, too, when you think about it. So it's pretty interesting.
Yes.
So,
because
aside from hepatitis.
Right.
The others have treatments, but they're all treatments. They're
Mm-hmm.
not preventatives. They're not
Right.
vaccines.
Right.
Well,
Well, this one has a treatment too. I mean, when I worked at urgent care, I'm just going to say I worked in Cedartown, and I saw a lot of HPV with young girls down there with different types of cervical abnormalities that were precancerous lesions related to the HPV. And there are certain treatments that they can get to slow it down. Unfortunately, a number of those young ladies ended up not able to carry babies because they did develop significant abnormalities in their cervix that required some type of surgical intervention. So it is a bigger issue than people realize.
So now you just extended for me. So it's not just prevent cervical cancer. Now we're even talking about potentially childbirth.
Yes, any cervical abnormalities could lead to difficulties carrying an infant. So.
Oh, wow.
Well, in the same way, are there treatments for young men?
Yes, same thing. Actually, I treat a number of guys, and the different types of medications to get rid of the lesions before they become large enough to require surgical intervention. Yeah.
So let me ask you this, Doc, and Angie, either one. So I'm assuming once a male has HPV, and he has lesions at that point, so is it just treatable at that moment? So, but it's not something you can be healed of, but it's just treatable at that moment.
It is not curable.
Yeah, it's a virus.
Yeah. Okay.
Viruses are not curable. They're only treatable.
Okay.
Now, there are some strains of HPV, the ones that don't cause the problems, that will just clear your body on its own. Remember, I said there's over 100 strains.
Right. Yeah.
It's the 4 strains we're worried about, and those are not curable, but we can treat the symptoms.
Yeah.
And an interesting thing, even with cervical cancer, and for women, it's about not only getting the vaccine, but as they get older, be sure that they're having regular pap smears, because that's how we're going to detect if there's any abnormalities. Cervical cancer has a very high rate of being cured if it's caught early.
Yeah, like prostate cancer.
So really, we're talking about awareness on both sides.
Yes.
Of females making sure they take their annual paps, and for guys, actually, vaccination.
Yes.
I guess the earlier the better.
Yes.
Right.
And that's why the vaccine's starting at 9, because you really want to start it before there's any sign of sexual activity, so that you know there's no virus present, so you know you're going to prevent those viruses.
Yeah.
So, getting the word out, I would guess that pediatricians, for the most part, are talking to patients and the parents about this. What else? I mean, and talking about it on TV is probably going to help a little bit. But what are some of the other things that are going on to try to get this word out?
One of the things, actually, the Centers for Disease Control has actually started a new campaign. So I haven't really seen any of the advertisements on the Atlanta stations yet, but that is the plan. They are working on really doing a heavy campaign for public awareness with a strong focus on this is a cancer vaccine.
Yeah, I've seen the commercials for the guys, trying to encourage the guys to go and get this shot. But outside of that, I really hadn't seen too much.
No, I know they're planning on some things, so we should start to see some more.
Yeah.
But I, as a father with three boys, I mean, this is just really hitting me because I mean, you just take certain things for granted because you know about certain viruses and certain STDs, and you hear about them. But I'm just thinking from the perspective that as a man, we have a bigger role to play in this because when you talk about it so common and so prevalent, you just that means it's out there, and it's not like so you really plan. You really just it's out there. And so the likelihood that you could come across it is very likely at some point. Especially if you're very, let's say, just moving about.
Yes.
And so I guess for me, it's just kind of really pressing that, we have to do more to make sure people understand, that men understand that they're at risk as well. So I know, because I know we don't have a lot of time, but you had said that we're starting to see some data that men are now showing signs or men are suffering from this.
Well, anal cancers. I mean, anal cancers or any cancers in the entire genital urinary system down, including even on the skin, the thigh and the groin area. I mean, you can have the cauliflower-like growths or whatever. Pretty much, if you would just, I would like to compare it to herpes. It's very virulent. It's spread the same kind of way, and you don't know it until oftentimes it's a little late. Same kind of thing.
So really then, if you are 26, 9 to 26, and you're a male, unless you have been diagnosed with it, you really should be getting the vaccine.
Yes.
Yes, and hopefully at age 9 you haven't been diagnosed.
Yeah, well, it's 9, but you really should be going to get a vaccine.
And if you know what the prevalence rate is, we talked about it's very common. It's the estimated prevalence is half of all sexually active adults have some form of the
HPV.
human papillomavirus.
Yeah.
Half of all adults.
Sexually active
So
adults.
it's just me and you, when one of us. They're saying half. I mean, if it's 2 of us, what?
And we're both over 26.
Yeah, so
It's true.
wow. But I'm glad Angie called us because the 100 working with the Omegas, we are doing a campaign. Dr. McCoy actually will be talking to a group of men, adults and young men about HPV, and we'll be doing that on April the 7th. But this conversation has just changed, the urgency for me, because we have to make sure we take it even bigger than the guys we'll be working with, because this is, I'm just thinking about all the young men I come in contact with as a teacher, and knowing some of them and knowing some of their habits, and I wasn't aware, so I'm quite sure they probably wasn't aware of some of the dangers that are lurking out there. So it really changes things.
Yeah. I would like to stress abstinence, 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 and prevention, prevention, prevention. So if you're going to be sexually active, wear a condom. I mean, it's not just for HPV, but it's for hepatitis, GC, chlamydia, yada yada yada, herpes.
The whole 9.
The thing about these viruses is that once you make family with them, they're always family. So you want to prevent that. It's with you for life, so.
It's not the kind of family you want.
That's exactly right.
Well, we're coming up on a break in just a few seconds here. So when we get back, maybe we can give some information about your event and contact for more details. Stay with us. We'll be right back with that information after this.
The average text takes your eyes off the road for nearly 5 seconds.
Welcome back to Community Watch. We've been talking about HPV virus and vaccine with Angie Robinson and Dr. McCoy. If people want more information about this, where do they need to go?
Well, besides their family doctor or pediatrician, they can call the health department. Right. And that number's 706-295-6123.
Okay.
Right.
And can they call you, Dr. McCoy?
They can certainly call Healthy U of Georgia, Dr. McCoy.
Well, I hope...
Excuse me, and I would like to stress that the males call, because they're afraid to go into the health department, but come on, you can talk to a man, and you don't have to go and talk to a lady. But anyhow.
Well, in any case, it's just a crucial issue that we all need to take mind of and act. I want to thank our guests, and I want to thank you for joining us this week. We'll see you next time on Community Watch.
Thank you.